helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Katie Wilson. Today we've got Jenny Edwards and Christy Franklin with the St. Mary's Regional Stroke Center. Thank you guys for being here.
Thank you for having us.
Yes, so today's an exciting day because we have some pretty big news about the Stroke Center and our area. So let's hear it.
Okay. Well, we're very proud to announce that St. Mary's Medical Center is now certified as a comprehensive stroke center.
Okay. Sounds like a big title. What exactly does that mean?
Comprehensive Stroke Center is the highest certification level achievable in the stroke care. We meet high levels of standards that were set forth by a national organization. We went through a very rigorous on-site review, and basically it means that we are 24 hours a day, 7 days a week. We can provide advanced level of care for all types of stroke patients. We have our staff, physicians and staff, specially trained in neurology, neurosurgery, and endovascular care.
Okay, so clearly this is something that you guys worked very hard on. How big of a deal is this? I mean, this sounds like this is a pretty big deal.
Yes. Across the nation, there are only a small number of centers who have achieved comprehensive level certification.
Okay, well, congratulations. Very exciting to have, medical care at this level in our area. And every time that you guys are on, we do also talk about just some of the signs of having a stroke, just so people are aware. So let's go over those again.
Okay, yeah, it's real important that people recognize their acronym BFAST for balance. Are they having trouble with their balance, trouble walking? Are they having problems with their eyes? Have they had a change in their vision? The F for fast, face. Do they have any facial droop, facial weakness? Arm, have them hold their arms up. Do they have an arm drift or arm weakness? And then the S stands for speech. Are they having any difficulty with their speech? Is it slurred, garbled? Are they making sense? And then the T is time. It's really important to, try to call 911, get to the hospital as soon as possible.
Right, and that was a point I know you guys wanted to make, was that it's very important to call 911 instead of trying to bring the person to the hospital yourself. Why is that so important?
Well, if they call 911, then EMS, when they pick them up, they can pre-notify the hospital, and so we can activate our stroke team even before they get to the hospital. So we'll have the CT scan table cleared off and ready to go, and the team will be activated and know that they're on their way.
Okay, so let's talk about the Stroke Center a little bit more. Is there anything else that you want viewers to know about it besides the fact that you guys are now comprehensive and you've reached this next level?
I think the importance of time, as Jenny mentioned, of knowing the symptoms, and no matter what treatments we have available, unless the person gets there in a timely fashion to get evaluated, we would not be able to help them. And so the quicker they can get treatment, the better the outcomes and less disability.
Okay. What if, let's say, if someone believes that they may have had a stroke, but they kind of come to this realization days later? What do they do then?
They still need to, if they think that they've had a stroke, they still need to come to the hospital and be evaluated. Once you've had a stroke, you're at risk for having another.
Okay.
So you want to help them take measures to reduce their risk for having recurrent stroke symptoms or recurrent stroke.
And will you just remind us where the Stroke Center is?
The Stroke Center at St. Mary's?
Yeah, just where St. Mary's is.
Oh, it's here in Huntington, 2900 First Avenue.
Okay. And if someone wants to make an appointment, what's the best way to do that?
Well, I'll leave that to let Christy speak about that.
Well, if it's an acute onset of symptoms, just go to the emergency room.
Okay.
And otherwise, you could go through your family practice doctor or see a neurologist if it's an outpatient issue. But for acute stroke that we're really focusing on with the Stroke Center, it would be to get to the emergency department.
Okay. Well, clearly very, very important information. Thank you guys so much for being here. We really appreciate it. And congratulations on this new level. That's very awesome. So if you guys want to watch this again, you can just go to WSAZ.com, click on the Moms Everyday tab. Have a great day.